I'm here with Rick Hopfer, who's the CIO at Molina Healthcare. And Rick, it's a real pleasure to have you here today. We're going to talk about digital transformation. And Rick, I'm going to start with just asking you what you're doing at, what your responsibilities are and what you're doing at Molina Healthcare.
So Molina Healthcare, I've been CIO there for about 6 years. And for me, the interesting thing was prior to 6 years ago, I had no healthcare background. So
wow.
It was a CIO with multiple industries coming into healthcare at a time when there was a lot of change going on in healthcare. So if you think about it, 6 years ago was before the Affordable Care Act had been passed, and here we are 6 years later and talking on a day where it may be repealed. But the last 6 years has been it's been an exciting time being CIO in that company that went through very, very rapid growth, primarily because it is focused on government programs. So Medicare, Medicaid, primarily are it's a very mission-driven company that's focused on helping financially vulnerable families and individuals on government programs. So we grew a lot in the last 6 years, and we'll wait and see what happens the next 6. So.
How do you look at the industry right now, and in terms of digital?
From an industry perspective, and I think where we can all agree there's a lot of opportunity to improve healthcare, shave costs. I came from an industry that was more on the entertainment side, so the impact of digital on business models had a very rapid. In healthcare, it's a little bit slower, so you do see business models that are starting to change, but that's not to say that digital transformation can't have a big impact. Because of things like regulatory and compliance, a little more conservative, but still a lot of opportunity to shave costs out of the whole healthcare process, and I think digital will have a big impact with that.
How do you view digital transformation in the context of all that? Are your ecosystems changing? Are they expanding? Is it the way you handle them?
Yeah, and again, it depends on. I mean, we could focus on almost all aspects and see what's the impact digital is bringing there. Right. Because of the type of healthcare that we are providing today, it's multi-state driven, and today each state can really adopt some of those programs differently. So it's very hard to broadly come out with a digital solution that will impact all of our states because each one of them has regulatory or compliance issues that are different. But again, starting with just looking at members generally. Right? Every member, and again, it's really changed and evolved over the last few years, but most people have a smartphone today. And so how do you leverage that? On the provider side, we deal with very large hospitals down to sort of much smaller clinics, and again, depending on the hospital system, the provider system, they're in various stages of technology savviness, and there really aren't a lot of standards. So how we transfer information back and forth between those, there are some standards today, but there's also a lot of non-standard approaches where an individual hospital system may demand information being transferred one way, and another hospital system in another state may be another, and it's expensive on the part of the payers like us to try to figure out what's the best way to do that when there aren't standards in place. And how do we do that as efficiently, as effectively, leveraging the technology, and then you wrap all that with security. There are, again, a lot of opportunities to figure out how to do it smarter. If we could standardize on some of that, but because we're not there yet, we're still trying to figure that out. Now, within the company, there's also ways that we can leverage digital and digital transformation. So if you think about the member-provider experience and the relationship we have there, certainly, we are looking at other industries, who have done a very good job of creating the relationships, whether it's the entertainment companies or retail companies. We can learn, and I think healthcare companies in general can learn, because I think there are other industries that are more advanced, and so we do get the benefit of sort of watching to see how things have been working. Specifically within Molina Healthcare, because many of our members are, either teenage mothers, or we have a lot of children. We have aged, blind, disabled. We've got mentally challenged. They're not your typical mobile smartphone technology savvy consumer. So we are trying to figure out how can we make it easier and how do we leverage that relationship. But there are a lot of things that we can be doing internally with our own processes to look at how do we become more efficient internally regardless of the relationships we're building. And so we are spending a lot of time looking at all of our core business processes to see where can we overlay some digital transformation. And, you know, what we're trying to do is, in addition to making sure we're offering the best member experience, or what we want to do is really create a quality of life for our members. Internally, we have extremely small margins, and so we have to be as efficient as we can. So wherever we can shave out costs, we're looking at how to do that, and digital offers us a big opportunity to do that.
That's very interesting. Can you share with us a little bit of what you've learned now as you've been trying, you know, on your journey
Sure.
towards digital, you know, what you've learned in this very complex and challenging industry, but very essential industry, you know, very critical
Well,
industry.
and again, for someone coming in 6 years ago, a little bit naive into what I was walking into, my expectations were 6 years ago, you know, we need mobile apps. And, you know, we need to be doing this for collaboration. And why aren't we doing telehealth and telemedicine across state lines? And, you know, it was a bit of an education and an awakening and learning as I got more into it to find out this is really complex.
Yeah.
Security is such a huge issue today, and so, you know, everything around compliance and high tech and, you know, CMS regulations, all of those add to the cost and the complexity, but securing patient information is really paramount. So we have to be doing that. That also means things that other industries, again, have been able to do a little bit quicker, movement to the cloud and taking advantage of that. Those are things that I think, you know, specifically in our company, we've been a little more conservative, but we are now in a position where, you know, I believe we will really start to leverage, you know, some of the newer, you know, whether it be cloud-based technologies. We're doing a lot more now internally with, you know, DevOps and bimodal IT, but we're looking at Agile. So we're taking the things that other folks are doing and we're figuring out how do we adopt them? And then when we can, let's start leveraging those in a way that we can still be compliant. Getting business associate agreements is something where I learned after getting in is it's a very legal, cumbersome process about who's going to have responsibility for some of the indemnification. And quite frankly, it's taken us a year to get through a legal process to get to the point where we have an agreement in place where we can now start to use some of that technology.
Yeah.
But it's getting easier, and I think we're moving faster, and I think, you know, the industry and our company specifically is in a position to really start taking advantage of, again, what are the solutions under what you put a digital transformation umbrella would be.
Yeah. So it seems like the technology side of the healthcare industry, particularly in your area, has a long tail, a long future that's likely to be mined for quite a few years. Do you see that as ultimately transforming the industry in a pretty significant manner?
Well, absolutely, and again, I think technology is going to enable us to do that. The more we can share information, you know, again, whether it's anonymously or not, but the more we know about an individual, the better we can take care of that person. And so the more we can share, and partially, you know, again, our membership comes in and out. You know, it could be in a year and out a year and back a year. Well, in the year they're out, they may be going to see another physician.
Yes.
And today, trying to get all of that information correlated between, you know, what medicines they've got, what prescriptions are they taking, you know, what physicians have you know, advice they've given. Those are all pieces of information that once we can start collecting all of that from all those different sources and then start analyzing that, we'll be able to do a much better job at an individual level of helping people stay healthy.
What do you see, based on your experience in other industries and now in the healthcare industry, what is healthcare going to give back in terms of digital transformation to other industries? What kind of insights do you think might come forth from the healthcare industry?
I think if the healthcare does a very good job of leveraging the technology, we're going to have healthier people in every other industry.
Yep.
So we're going to give back in a way that hopefully is going to help, you know, everyone become healthier.
Yep.
And hopefully the technology has something to do with all of that.
Yeah.
Now, are we going to develop the algorithms that are going to take you know, the next retail? I'm not sure we're going to get there.
Yeah.
But I do think there's a lot of opportunity, and specifically in healthcare, where it may be unique from other industries. And again, as you get into it, you know, DNA or genomics, there's a lot for us to learn there, and hopefully we can contribute some of that back.
Excellent.